Sleep is one of the most fundamental aspects of our well-being, yet it's something that many of us struggle to achieve consistently. We've all experienced those restless nights where sleep seems elusive, but for some, this isn't just an occasional inconvenience. It's a chronic issue that can take a serious toll on health, mood, and daily life. How do you recognize when a sleep problem becomes a disorder? What are the underlying causes, and how can you find your way back to restful nights? Welcome back to Health Square, the podcast where we dive deep into the essential health topics that affect your life. I'm Bills, and today we're tackling a subject that many of us struggle with at some point in our lives: insomnia and sleep disorders. We've all had nights where sleep seems impossible, but for some, these sleepless nights aren't just occasional, they're a regular occurrence. Insomnia and other sleep disorders can take a significant toll on your health, well-being, and daily life. In this episode, we'll explore the causes of insomnia, how to recognize sleep disorders, and what you can do to get the restful sleep your body needs. Let me start by sharing a story about Sarah, a friend of mine who's always been a night owl. Sarah thrived on late nights, whether she was working, watching movies, or scrolling through social media. But over time, her late nights turned into sleepless nights. She found herself lying awake for hours, unable to fall asleep, even when she was exhausted. Her once occasional sleepless nights became chronic insomnia, leaving her drained, irritable, and struggling to keep up with her daily life. Sarah's story is a reminder of how easily our sleep patterns can be disrupted, and how difficult it can be to reclaim a good night's sleep once it's lost. What is insomnia? Understanding the physiology of sleep. Before we delve into the causes and types of insomnia, it's important to understand what insomnia is and how it relates to the physiology of sleep. Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. But what exactly happens in our bodies that leads to insomnia? Sleep is a complex process controlled by our brain. The hypothalamus, a small region in the brain, plays a key role in regulating our sleep-wake cycle, also known as the circadian rhythm. This internal clock responds to cues like light and darkness, signaling our body when it's time to sleep and when it's time to wake up. The release of certain hormones, such as melatonin, also plays a crucial role in making us feel sleepy. However, when something disrupts this process, it can lead to insomnia. For example, Sarah's late-night habits disrupted her circadian rhythm. The exposure to blue light from screens late at night interfered with the production of melatonin, making it harder for her to fall asleep. Over time, her body's natural sleep-wake cycle was thrown off, and she found herself lying awake night after night. Types of insomnia. Understanding the variations. Insomnia isn't a one-size-fits-all condition. It can manifest in different ways. Let's explore the types of insomnia and how they can impact your life. Acute insomnia is short-term and often triggered by a specific event or stressor. For example, Jake, a colleague of mine, experienced acute insomnia during a particularly stressful time at work. He was preparing for a major presentation, and the anxiety kept him awake for several nights. This type of insomnia usually resolves once the stressful situation is over. Chronic insomnia, on the other hand, lasts for at least 3 nights a week for 3 months or longer. This was the case for Sarah, whose sleep issues persisted long after she realized her late-night habits were affecting her sleep. Chronic insomnia can have a significant impact on your health, leading to fatigue, mood disturbances, and difficulty concentrating. Onset insomnia is when you have trouble falling asleep at the beginning of the night. This was Sarah's primary struggle. She would lie in bed for hours, unable to fall asleep, even when she felt tired. Onset insomnia can be particularly frustrating because the longer you lie awake, the more anxious you may become about not sleeping, which only makes it harder to fall asleep. Maintenance insomnia occurs when you have difficulty staying asleep or wake up too early and can't go back to sleep. My friend Mike experienced this type of insomnia when he was going through a difficult time in his personal life. He would fall asleep easily but wake up in the middle of the night with his mind racing, unable to return to sleep. This type of insomnia often leaves you feeling groggy and unrefreshed in the morning. Causes of insomnia. Identifying the triggers. There are many factors that can contribute to insomnia, and understanding these triggers is key to finding a solution. Stress and anxiety are among the most common causes of insomnia. When your mind is preoccupied with worries, it can be difficult to relax enough to fall asleep. For instance, Sarah's insomnia began when she was dealing with work-related stress. Her mind would race with thoughts about deadlines and responsibilities, keeping her awake at night. Poor sleep habits can also contribute to insomnia. Staying up late, using electronic devices before bed, and irregular sleep schedules can all disrupt your body's natural sleep-wake cycle. Sarah's habit of staying up late and using her phone in bed made it harder for her to fall asleep, eventually leading to chronic insomnia. Medical conditions can also cause insomnia. Chronic pain, asthma, and conditions like restless leg syndrome can make it difficult to fall asleep or stay asleep. My neighbor Carol, who suffers from arthritis, often finds herself waking up in the middle of the night due to pain. This type of insomnia is particularly challenging because the underlying condition needs to be managed to improve sleep. Medications can also interfere with sleep. Some medications, such as those for high blood pressure, asthma, and depression, can cause side effects that disrupt sleep. Mike, who was on medication for his high blood pressure, noticed that his insomnia worsened after starting his prescription. After discussing it with his doctor, they adjusted his medication to one that didn't interfere with his sleep. Environmental factors such as noise, light, and temperature can also impact sleep quality. For example, Rachel moved into a new apartment that was on a busy street. The noise from traffic and streetlights made it difficult for her to sleep, leading to the development of insomnia. Related sleep disorders beyond insomnia. Insomnia is just one of many sleep disorders that can disrupt your rest. Let's take a look at some related sleep disorders and how they manifest. Sleep apnea is a disorder where your breathing repeatedly stops and starts during sleep. It often causes loud snoring and can lead to waking up gasping for air. This disrupts your sleep and can leave you feeling tired during the day. Jake's father, for example, suffered from sleep apnea for years without realizing it. His snoring was so loud that it kept the whole house awake, but it wasn't until he started falling asleep at work that he sought medical help. A sleep study confirmed sleep apnea, and he was treated with a CPAP machine, which helped him sleep better and wake up feeling more rested. Restless leg syndrome, RLS, is a condition that causes an uncontrollable urge to move your legs, usually because of an uncomfortable sensation. It typically occurs in the evening or nighttime hours when you're sitting or lying down, which can make falling asleep difficult. Carol, who has RLS, often struggles with the sensation of tingling or itching in her legs at night, making it nearly impossible for her to fall asleep. Narcolepsy is a neurological disorder that affects your ability to control your sleep-wake cycles. People with narcolepsy may experience sudden sleep attacks during the day, where they fall asleep without warning. My friend Mike's brother, who has narcolepsy, has to manage his condition carefully with medication and lifestyle adjustments to avoid falling asleep in dangerous situations, like while driving. Circadian rhythm disorders occur when your internal body clock is out of sync with your environment. This can happen with shift work, jet lag, or simply having a natural sleep-wake cycle that doesn't align with the typical day-night pattern. Sarah's late-night habits eventually led to a circadian rhythm disorder, where her body was more awake at night and tired during the day. It took a concerted effort to reset her sleep-wake cycle and get back on track. Managing insomnia, medications, dosages, and treatments. When it comes to managing insomnia, there are several approaches you can take, depending on the underlying cause and severity of the condition. Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard for treating chronic insomnia. CBTI helps you change the thoughts and behaviors that contribute to your sleep problems. For example, Sarah worked with a therapist to identify the thoughts that were keeping her awake at night, such as worrying about not getting enough sleep. Through CBTI, she learned relaxation techniques and ways to restructure her thinking, which helped her fall asleep more easily. Medications can also be used to manage insomnia, but they should be used with caution and under the guidance of a healthcare provider. Over-the-counter options like melatonin supplements can help regulate the sleep-wake cycle, especially in cases of circadian rhythm disorders. Sarah tried melatonin to help reset her sleep schedule, taking 1 to 3 milligrams about an hour before bedtime. It helped her fall asleep more easily, but she only used it for a short period as part of a broader sleep plan. Prescription medications, such as benzodiazepines or non-benzodiazepine hypnotics like zolpidem Ambien, can be effective for short-term use in managing insomnia. However, they come with the risk of dependence and should not be used long-term. Jake, during his period of acute insomnia, was prescribed a short course of a non-benzodiazepine hypnotic. It helped him get through his stressful work period, but he made sure to discontinue its use once the stress was resolved to avoid dependence. For restless leg syndrome, medications that increase dopamine in the brain, such as pramipexole, Mirapex, are often used. Carol, who suffers from RLS, found relief with a low dose of pramipexole, which she takes in the evening to reduce the uncomfortable sensations in her legs. In the case of sleep apnea, lifestyle changes, such as weight loss and sleeping on your side, can help. But many people require a CPAP, continuous positive airway pressure, machine to keep their airways open during sleep. Jake's father experienced a significant improvement in his sleep quality and daytime energy levels after starting CPAP therapy. When to seek help, recognizing the need for professional support. While occasional sleepless nights are common, persistent insomnia or sleep disorders should not be ignored. If you find that your sleep problems are affecting your daily life, it's important to seek professional help. A sleep specialist can conduct a sleep study to diagnose conditions like sleep apnea or narcolepsy, and they can work with you to develop a treatment plan tailored to your needs. If you're using sleep medications regularly, or if your sleep issues are causing you significant distress or impairing your ability to function, it's time to talk to a healthcare provider. They can help you identify the underlying causes of your insomnia and recommend the most effective treatment options. Remember Sarah's story. What started as occasional sleepless nights turned into chronic insomnia that affected every aspect of her life. It wasn't until she sought help and made changes to her sleep habits that she was able to reclaim restful nights. Whether it's through lifestyle changes, therapy, or medication, there are solutions available, and you don't have to suffer through sleepless nights alone. Conclusion: taking control of your sleep. Insomnia and sleep disorders are more than just inconvenient. They can have serious implications for your overall health and well-being. But with the right approach, you can take control of your sleep and improve your quality of life. Whether you're dealing with acute insomnia, managing a chronic condition, or just trying to get a better night's sleep, understanding the causes and solutions is the first step. Thank you for joining me on Health Square today. I hope this episode has provided you with valuable insights into understanding and managing insomnia and sleep disorders. If you found this episode helpful, please subscribe, leave a review, and share it with anyone who might benefit. Remember, good sleep is essential for good health, so take the time to prioritize your rest. And until next time, take care.